Just how safe is this information that is being collected by Apple?
So far, the security analysts I talked to said that, Apple's taking a pretty cautious, slow approach to this. There's a few different ways health information is being collected on you. One is this health kit, which basically stays in your phone. The one analyst I talked to said it's basically sort of shrink wrapped in your phone, and it can track various information about your health. But an area where you might need to worry is a new device app they have called Research Kit. And now the issue there is that it's sending health information from your phone or from your iWatch or other devices out of your phone into the cloud to Apple. And that's sort of the area where you get into risk. Whenever something is leaving a device and going out somewhere else, it can be intercepted and essentially hacked or stolen. At this point, there's no requirement for encryption when it comes to sending information to this Research Kit element. So that's probably going to be one thing that Apple's going to have to develop along the line, but that's a potential risk there. So they do say, though, that researchers kind of need to take a slow, methodical, careful approach to how they develop these products because of the risk of hackers.
And that slow, methodical, careful approach also applies to consumers as well.
Well, sure. I mean, they have to, if I understand correctly, they have to approve it, right? I mean, they just can't take the information. I have to say it's okay for them to send the information out, right?
Yeah.
So there is some kind of backstop.
There is, yeah. And Apple is very aware of these privacy concerns and trying to take a slow, cautious approach.
I don't know if you guys saw, but there was an iTunes outage today.
Absolutely,
so you
yes.
couldn't actually download. And the question was, is this a data breach or is this just sort of an issue with the system? And of course, a data breach would be much more significant.
Okay, we have talked a lot about data breaches as relates to health information. And as you say, it's more precious for thieves than credit cards or any other information out there.
Right. So the security experts, the people who live in this hacker world who I've talked to, they said that Apple so far, maybe not the one you have to worry about, but there's a lot of our health information that we are sharing through lots of different digital platforms, whether it's on an Android device, which is more susceptible to hackers and getting breached. Sometimes people can download an app that can then sort of attack another app and steal your health information there. Fitbits, Jawbones, all these other devices. There is a massive amount of information now being collected on our health. It is out there. There are a whole variety of different privacy protections around it. The federal HIPAA privacy law does not apply to anything that's collected outside a doctor's office or a health insurer.
So what's the protection for that data then?
Whatever protection the company collecting it has put into place, whatever that privacy policy says, whatever encryption they decide or don't decide to do. People need to be aware that this information is fair game to marketers and accessible to hackers if they're on the right protections by the company.
What's so concerning about that, too, is that we've seen hackers be so much more ahead of companies in every kind of way, and there has been such a difficulty in lining up the FBI and companies to sort of share information and share data so the FBI can actually aid companies in sort of stopping hackers and doing research there. There doesn't seem to be a good conversation yet.
Okay, to Alix's point, Shannon, why are the hackers always one step ahead? Why does it seem that for those who are trying to protect the information, it's 2 steps forward, 1 step back?
Well, part of the problem in the health world is that we have HIPAA, this years-old privacy law that really kind of set the standards of security around this. But that legislation's out of date. So it's up to the companies, the industries, to be the one to put additional security on top of that. Healthcare hasn't really been a target for hackers until the past couple years. That's because our financial data was very valuable. But now the black market has this demand for health data because of medical identity theft or because of corporate and state-sponsored espionage. And that's making health information all of a sudden valuable out there.
Oh, okay. So the idea for these apps was obviously to help people keep track of their health, not just rely on your doctor to do it, but for you to keep up with what's going on, whether it's cardiovascular, whether it's blood sugar levels or whatever it is.
And you could also make the argument that we've seen Apple sort of want to diversify into businesses, right? They're partnering up with IBM with the assumption, of course, hey, I want to sell my iPad to your company, and you can make the argument, well, if doctors use iPads and are able to transmit data, that could be a huge entree into this landscape for Apple.
What are the research implications for diseases if you have these apps?
Yeah, well, as you said, there's a lot of great things that could come from these apps. People can better manage their health. Researchers can more easily recruit patients. They could have a patient with Parkinson's disease having an Apple Watch, and it's sending data to their, on their movements and whether they're improving or not, and sending them to a researcher real time, not just 5 minutes in a doctor's office once a month.